We at Allina Health are fully committed to providing all our expectant mothers with the best possible care. That care includes a dedicated anesthesia team to provide you as much comfort as possible during the birth of your child. Your anesthesia team may include an anesthesiologist, a nurse anesthetist, or both. These individuals are physicians or nurses that have received specialized training in anesthesia care. During your labor, you will have many pain relief options available to you. One of those options does include a procedure called a labor epidural. Simply stated, a labor epidural is the placement of a small, flexible plastic tube about the size of a wet piece of spaghetti. This small tube is inserted through the skin of the lower back using a needle. After the tube is placed, the needle is then removed and the small tube is secured using tape. Specialized pain medicine is then given through the epidural to help decrease the pain associated with labor contractions. This medicine can be continued right up until the birth of the baby. Epidural pain medicine can provide you excellent pain relief during labor, while also minimizing any direct effect on your baby. The medicine can be continued the entire time you are in labor, and the epidural can often be used to provide surgical anesthesia if the need for cesarean delivery is made by your obstetrician. However, there are some potential side effects and risks associated with the labor epidural. These include a decrease in the woman's blood pressure after the epidural medicine is started. There is also a small chance of developing a headache from the epidural procedure, which occurs in about 1 out of every 100 women. Other risks are extremely rare and include injury to nerves, bleeding near the epidural, or infection in the area where the epidural is placed. These occur in less than 1 in 50,000 women. The most common complaint from women in labor is that the epidural medicine is not relieving their pain. Common situations include labor pain not decreasing after the epidural is started, labor pain increasing again after a period of being relatively pain-free, and labor pain being felt on one side of the body more than the other. This might include the need to replace the small tube in your back. In all of these situations, your anesthesia care team will work hard to adjust the epidural medicines and fix any problems you're experiencing.
If you decide on having a labor epidural, the process begins by having an IV, which is a small tube that is placed in the vein in either your hand or arm. This tube will allow you to receive some IV fluid before the epidural is actually put in. This fluid may help to minimize the blood pressure changes sometimes seen when the epidural medicine is started. Now, when the anesthesia care team arrives, they will ask you to sign a consent form giving them permission to put in the labor epidural. You may be asked to either sit up or lie on one side in order to expose your lower back for the insertion of the labor epidural. Your back will then be cleaned off with special soap to minimize the chance of causing an infection near the epidural site. A small amount of local anesthesia medicine will then be used to numb a small area of skin on your lower back. Through the numbed up area of skin, a larger needle will be used to find the correct spot for the labor epidural. When the correct location is found, the epidural will then be inserted and the larger needle removed. The small tube will then be secured in place with tape. Once the epidural is taped in place, you will be assisted back into proper position in your bed. You will then receive the appropriate medication through the epidural. This medication does not work immediately. For most women, the pain relief will start within 10 to 20 minutes after starting the medicine. During the first 30 minutes after the medicine is started, your vital signs, including heart and blood pressure, will be closely monitored by your nurse and anesthesia care team. If your blood pressure changes, you may receive more IV fluids, medication through your IV to raise your blood pressure, or both, depending upon the situation. Pain relief from an epidural is gradual. It's more like a candle burning out than turning off a light switch abruptly. The goal for pain relief is about a 70% reduction in pain, although most women experience more pain relief than this. Even with good pain relief, most patients still know when they are having contractions. It is common to have a sense of pressure rather than a sharp pain. The epidural medicine will be given by a continuous infusion at this point to keep your pain relief going right up until you deliver the baby. You may be given a button to push that will give you an extra dose of epidural medicine if you feel like the pain is starting to increase again at some point. At Allina Health, your anesthesia care team is dedicated to making any adjustments necessary to maximize your pain relief. The epidural will be removed at some point after the baby is delivered and before you are moved to your postpartum room. The process is simple It mostly involves removing the tape from your back that is holding the epidural catheter in place. No needles will be involved at this point. Some women may experience some low back tenderness for a few days after the epidural is removed. This is related to the needle that was used to initially put in the epidural. Epidurals are a safe and effective form of pain control when a woman is in labor. If you are undecided, you always have the option of discussing the epidural with your anesthesia care team at any point during your labor. All of us at Allina Health are committed to seeing you through the birth process as comfortably and safely as possible.